Hi everyone, my name is Amanda. I'm one of the vet nursing tutors on the program. Today I'm going to be talking about wound healing complications. So I have here a picture of my dog Hunter, and he's going to be our wound case. So Hunter is a Hunterway Kelpie dog, and he was found at home with a cut on his left front paw pad about an hour and a half ago. So having a look at the wound to the left, you can see exactly where the location of the wound is. So it's quite a nasty cut there. And to the right, you can see a close-up image of exactly how that cut has affected the paw pad. So it looks pretty sore, and there's evidence of dry blood and a little bit of fur and just contamination beginning to appear into the wound. So here, our next step is to classify his wound so the right care can be given to the wound. So we have 4 wound classification options here. We've got clean and clean contaminated, and then we've got contaminated wound and dirty wound. So you'll see for a clean wound, that's often a wound made in surgery under aseptic conditions, whereas the clean contaminated is exactly this, but with mild contamination being present during that procedure. We can safely say that these 2 wound classifications will not be in line with the type of wound that Hunter has present. So looking at contaminated wound, this is a fresh traumatic wound which has occurred up to 4 hours or less, and a dirty wound is a wound that has occurred over 6 hours ago, which has meant there has been infection and contamination that has definitely started to take place here. So for Hunter, we can say that his wound classification is a contaminated wound as it has occurred within the last 4 hours. Now that we have this classification, we can think about our nursing considerations that will be important for Hunter's case. So assuming that Hunter has visited the vet clinic, the vet has assessed the wound and has decided to admit Hunter for the day so it can be cared for, the nurse's job is thinking about all of these additional things that are important for ensuring the best care is given for Hunter and his wound. So the considerations are not just looking at the diagnoses, which is he has a wound, but it's looking at Hunter as an overall. So we're thinking of the really holistic care that is needed. So the first one to consider is cage size. So we want a cage that is going to prevent Hunter from being able to walk around and put pressure and weight onto his wound. So a suitable cage size may be one that only allows him to sit in sternal recumbency, not one that he's able to walk around and move too much. We want to encourage rest. Preventing further contamination. We could do this by applying some puppy pads above the layers of bedding. This would just act as a protective layer between his wound and the possibility of any new contamination coming in from blankets, from the cage, from the clinic. Having that wound sitting on a clean place like the puppy pads would be a really easy option to protect the wound at this stage. Physiotherapy is also a really key component here. Cold therapy is really useful for that inflammatory stage. Some of the signs that we might see during the inflammatory stage is pain, discomfort, redness, swelling, and heat. Pain and swelling can be reduced when we apply something like towel-covered ice packs and applying this to the site for 15 to 20-minute intervals. We want to take care that we do not apply that ice pack until the site has regained normal temperature. Another physiotherapy option we have is passive range of motion, so that might include performing passive motions of the limbs and the body to increase flexibility and movement, and this is to prevent muscle atrophy. Muscle atrophy can occur when there is muscle wastage due to a lack of activity, which we may start to see as from today, because we're going to expect that Hunter's exercise is minimized while his wound is healing. Another consideration is obviously pain management. One way that we could support Hunter is by using a pain scale to assess whether the analgesia he has already been given is sufficient enough, and if it's not, we can inform the vet so we can meet the needs of the pain that Hunter is experiencing. So now that we've thought about the nursing considerations, we can think about the factors that might delay wound healing. So I've got quite a range of factors that may apply. Not all of these will apply for Hunter, and for each case you'll need to specifically highlight which is most important for your patient so that we can support them. So for example, we've got necrotic tissue. For Hunter, we don't see any evidence of any additional skin that is going to interfere with wound healing. It is simply a nice straight cut that we can see, but there are certainly some factors that will apply for Hunter. So what I've done is I've highlighted what we might expect to be a factor for Hunter's wound healing. So foreign body could be a possibility because we don't know how Hunter has gained this wound, so we will need to inspect that. That is clear. Possible infection, knowing the breed of our patient, which is a Hunterway, very active breeds. Movement is certainly going to play a part, and patient interference. This is something that we will see on arrival, whether the patient is licking and caring for the wound. This is going to tell us that the patient interference is going to be an issue, and we will need to put some things in place to prevent that. So here we have a list of things that is going to promote really good wound healing. So keeping those factors we've highlighted before, we have inspect for foreign body, so that is ensuring that we meet this concern. We also have clip, clean and lavage the site. Now clipping might not be necessary for Hunter with the location of the wound being on the pad, but certainly prepare for that if the vet decides it is going to be beneficial in wound healing. We also have bandaging the site. So this is going to occur when the wound has been fully cleaned and dried, and we can provide something like a little booty. So you can see to the right an image of a booty that you can actually create from recycled fluid bags. So this fluid bag is emptied and rinsed out and dried, and then we've placed some holes into the bag and put through a tie to put over the bandage site. So this is really helpful to send home for the owner to use when they take their pet out to go toilet. It keeps the bandage nice and dry and clean and prevents things like infection or just getting the bandage soaked. I've also put here providing an e-collar. So this is really useful for patients who are, of course, have access to their wound and their bandage site. We want to prevent them from pulling the bandaging off and getting to the wound because that's not going to promote good wound healing. The last step we have is follow-up assessment. So often the next day is going to be a really good time to give these owners a call and check in to see how everything's going. It gives them the opportunity to share if they've been having some real problems and give them some advice on how to still be promoting that really good wound healing. So for example, if they're finding that Hunter has lots and lots of energy and it's been hard to keep him confined and limiting their exercise, it could be talking to them about having some little treat activities indoors where he is busy and working on that and putting a lot of his mental energy into making him really tired. So use this as an opportunity check base with your owners. So, importance of prevention. So, preventing these different complications is vital in these little aspects I've put on this presentation slide. So obviously quicker recovery times, and they're back to their normal exercise, normal lifestyle, which is what we want. Less pain and discomfort in the long run. We can avoid surgical repair if we haven't already started with that, or if they have had surgical repair and the patient has managed to pull off the bandage and get to the site and open up the wound again, we're going to have to go back into surgery, which is a lot of stress on not just the patient but the client as well, and we can avoid lots of revisits at the clinic again. And these all kind of link into patient experience and client experience as well. We want to provide owners with everything they need to have a really quick recovery time for their pets, because as a pet owner, and as I'm sure the experience that you've had with pets as well, it's really hard to confine animals that are really active. We want to get them back to their usual day-to-day life. So really important to keep those all in mind. So this is a picture of Hunter's paw much later after his injury. You can see fully recovered and looking really, really great. And this is a positive example of what we can be looking at with really good care post-wound presentation. So hopefully this example has given you some ideas on how you can better support your patients and your clients and your staff team, and having some really clear expectations of what to look for and be prepared for, so you can really support everyone who is involved. Thanks everyone.